Media reporters sought to gain further insight from Minister for Health Mary Isaac ahead of the planned rollout of the island's COVID-19 vaccination program. A barrage of questions was thrown at Senator Isaac outside Parliament on Tuesday ahead of the Senate sitting with the motion on the extension of the state of emergency until May 2021 down for debate. Isaac was probed on the status of the immunization drive given the perceived proactive approach of neighboring islands like Dominica and Barbados, which have already begun receiving vaccine doses this week.
I do not know what systems these other countries have to verify the authenticity of the vaccine. For us, we have to go through the mechanism because that is where we will be able to ensure that the vaccine is approved, is an approved vaccine. Okay? We are hearing about a lot of vaccines right now, but as far as we know, the one that is approved to be distributed in the Caribbean so far is AstraZeneca. The others are still have components of the others that they are dealing with, as far as I know.
Last night in the House, Tourism Minister and Chief of the Command Center, Dominic Fede, said that we would be getting 185,000 doses of the AstraZeneca vaccine from India. Mm-hmm. Is that something that you are aware of?
Regardless of where it's coming from, I am aware of all the, the different avenues that the vaccines are going to be supplied from. But regardless of where it's coming from, it's the chances are it will go through the COVAX mechanism.
The rising COVID-19 death toll and the staggering number of cases have spurred a measure of consternation among some members of the population. But Isaac is standing on the government's management of the crisis.
We are giving the correct information as far as and as much as we can, because when you are looking at health issues, like I said, you have ethical issues also to consider. People do not want us, and it is not right for us to be out there saying, I'm always picking on Miguel, sorry. Somebody died of this and that, but the person also had COVID. We cannot say that. You understand? What good will it do for you to know that the person passed because of something other than COVID, it was COVID and all of that? These are just semantics. What is important is that we are losing lives.
Critics have questioned the reporting style of the Ministry of Health in categorizing COVID-19 related deaths. There have been complaints in some quarters about a perceived lack of clarity regarding the dissemination of information in certain cases. Isaac balked at questions of supposed ambiguity, accusing reporters of sowing the seeds of mistrust.
You all are too suspicious, and that is the problem. A national, a non-national, a tourist, a visitor, a guest. What is the big deal about that? What is important, like I said, is somebody has passed. One more person has COVID, and that is one too many.
So why stress
Wear your mask. This is what you all should be going out and telling the public.
If it's not important, why stress on the back door as a source of infection? That's the question.
Miguel, you don't know people are coming in through the back door?
Madam Minister, remove tourists are coming in as
so
well.
You want to pretend it's not happening?
So why stress on the back door and not also point
If
out
you are
visitors?
interested in protecting the people of this country as a media person, and you have a voice, you have a big role to play.
That's why I'm asking you a
right?
question. I'm interested, Madam Minister.
So, distance please. So, you do not have to try to encourage people not to believe in the system. You are causing people not to trust the system, and that is what you are doing.
Despite the ongoing blame game, one thing remains clear. The island's COVID-19 related death toll and cases are rising, and officials are battling to gain control of the escalating situation. Solange Alfred, HTS News Force.